People say that we choose this life. Who would want to choose that? Who would want to choose to be stressed out, to not have a place to shower, to not have a place to use the restroom, to be looked at by society and people around you like, oh, that person's homeless. And there's all these things that like people don't think about, and the stigma is really heartbreaking. Protect yourself, but yet don't not care anymore because this virus is happening, because we're still out here suffering, we're still out here hungry, we're still out here needing help.
As the number of infections of the novel coronavirus continues to spread across the United States, it is reaching one of the most vulnerable populations, the homeless. More than 500,000 Americans are homeless and have inadequate housing.
I believe that unsheltered people are the most vulnerable due to the fact that we're always out in the environment. I really don't have the funds available for me to pay any attention to what the government is saying about this virus right now. I am doing my best to stay clear of it and stay away from people whom are sick at all, but for the most part, I trust in God.
In San Francisco's largest shelter, St. Vincent de Paul's Multi-Service Center, at least 70 people tested positive for the virus, Mayor London Breed announced April 10th.
It'd be nice to get some help and some public outcry for things like when there's a pandemic and we have to worry about keeping clean, maybe washing stations at our place, maybe having some more people show a little more concern. You know, nobody wants to be in anybody's face or anybody's way out here. This is not someplace that people want to live. Nobody comes back out here because they're sick of living in a house and they want to live on the streets.
Just as many businesses and restaurants have not been able to survive the shutdowns and closings, nonprofits and charities are taking massive hits. Glide, a social justice group, continues to hand out hot meals in San Francisco's Tenderloin community.
There are efforts to take over hotels, and the city is doing what it can, to partner with providers like us. But if that doesn't happen very, very quickly, this population will be decimated. You're talking about a population that's already teetering, and it wouldn't take much to sort of tip the whole community over. And I think the sooner we can get folks off the street and into hotels, the better I think it's all going to end. But it's a heavy lift.
In Washington, D.C., Unity Healthcare has teamed up with Pathways to Housing D.C. to provide health care for people experiencing homelessness.
People experiencing homelessness have higher comorbidities or medical conditions that are concerning because of lack of access to good routine health care, preventive health care. They also are dealing with a number of stressors that raise their blood pressure. The food that they eat sometimes contributes to making their diabetes more poorly controlled. So at baseline, people experiencing homelessness have I would say, poorer health than their counterparts who are housed. This, I think, to me shows how homelessness is a public health crisis with or without the coronavirus, but the coronavirus really just brings it into stark relief.
Shelters across the country are struggling to follow social distancing guidelines while housing people living in group settings.
Quarantining and social distancing within a shelter is very difficult, if not impossible. We're trying to do a number of things to mitigate that by having all hand surfaces sanitized 2, 3, 4, 5 times a day, just to make sure that we're trying to tamp down any spread of infection. But really, these advanced prevention measures that we implemented about 2 weeks ago are really intended to just try to keep that virus out of the building to begin with. Oftentimes, the homeless population is the one that's forgotten about, even though they're the most vulnerable. We're just desperately trying to stay open to try to keep our guests sheltered and fed and COVID-19 free.
Sad to see someone walk away from you because you're homeless. You know, it was already like that before, but it's more harsh now.
People on the streets were considered a virus and a plague ourselves, rather than something to be pitied or looked after, or a problem to be solved.
Instead of people sitting in their house and being bored, throw a mask on, throw some gloves on, grab some baby wipes and socks, and come out and help your neighbor.